We are live, sir.
Good afternoon, everyone. Myself, Dr. Kanchan Durkar. I am consultant at Oasis Fertility, Pune. Today, we are here for our another Facebook live session, and our today's topic is how to manage stress during the fertility treatment. Today we have with us Dr. Nilesh Balkawade, sir, who is the clinical head and fertility specialist at Oasis Fertility, Vakad and Kharadi branch. We welcome you, sir, for the today's Facebook live session, that is
Thank
stress
you.
management fertility
Thank you,
treatment.
Dr. Kanchan.
Yes, yes, sir. Today we have a very important topic to discuss that our viewers will also like. That is what is the stress during the fertility treatment, and how does it affect the fertility, and what are the effects, how to manage stress during the fertility treatment. First of all, I want to ask what is the prevalence of stress during the fertility or in the infertile couple? What is the prevalence of stress?
Yeah. So basically, stress is a very important component of any individual's health. If we see the WHO definition of health, it is physical, mental, social, and spiritual well being. So, two components of this, that is the mental well being and the spiritual well being, both fall into this category of stress. Lack of any of this well being can cause too much stress in life, and this is going to affect your health, as World Health Organization has said. So basically, you need to be healthy to conceive, and if you are not healthy, if you have unnecessary or too much stress, this is going to affect your health in general, and this is going to affect your chances of fertility. So in the patients of infertility, s- the infertility per se, that is the patient is not able to conceive, this can give rise to stress, or the stress itself, like the stress in the day-to-day activities, day-to-day work, lifestyle, this can also lead to infertility. So both components are there. Either ways, this can cause problems. So the prevalence is very, very high, because I think every patient of infertility is stressful. But stress as a component of infertility or stress causing infertility, I would like to say at least one third of the patients today, due to their stress and changed lifestyle, have problems with their gametes, have problems with their eggs, have problems with their sperms, and this can in turn relate to their infertility problems. So there is definitely a very high component, a very high chances of infertility due to this stress.
Okay, sir. So the next question is, what are the effects of this stress on males and females during the fertility treatment, or what are the issues they face due to the stress?
Right. So basically, divide it into uh, male infertility and female infertility. In female infertility, usually the we see that in Indian society, the females are usually blamed for not having a child, even if it is a problem of a couple. So it has got a stress component on at the level of couples. She has her own anxiety of conceiving. She's answerable to her partner, she's answerable to the family, and also to the society at large. We had a program in Foxy a few years back which was named My Banj Nahi Hu. The woman has to tell her story that she is not infertile. It's we who are infertile. It's the couple who is infertile, and therefore, this stress should not be a component of only a female. And this female infertility due to stress can be due to the problems associated. Can be menorrhagia, metrorrhagia, uterine problems. Along with that, there can be hormonal disturbances. There can be if the female is having a higher antral follicle count and a predisposition to PCOS, the severity of the PCOS is also going to increase because of this stress. Stress can also cause decrease in the ovarian reserve, which is observed these days. It can also lead to some form of addictions, and these addictions, in turn, like smoking, can predispose to lower egg reserve, and problems associated with that. The tubal motility can decrease due to these addictions. So on and so forth, problems can be seen in females due to the stress. Once they conceive, there is high risk of miscarriage also in these patients who have stress. The stress can be also associated with pregnancy induced hypertension, and therefore this has its complications are seen even in the pregnancy. So I feel in women there is high chances of problems with infertility, miscarriage, and pregnancy seen with stress. When we come to men, men also do have stress. They don't like to express it. They keep the stress to themselves, and this maybe increases their levels of stress too much. They can have health related issues. There can be problems with the sperm count, motility, and morphology when there is associated stress. We see that this there is a in body there is a balance of this bad and good hormones. So the good hormones, the endorphins, are very, very much necessary for a smooth functioning of the whole body, and this includes the fertility department as well. And men are usually more prone to addictions because of this stress, and this can in turn cause a problem. So the addictions like smoking, alcohol, or drugs can problem cause problems with the sperm count, motility, and morphology. Sometimes it has been shown to also cause severe problems like severe oligoasthenoteratospermia. This all can cause infertility.
Okay, sir. So, so far we have discussed the effects or effect of stress on male and female fertility potential. So, we like to discuss whether does the stress affect the normal conception, or does it affect the does the stress affect the effect of success in IUI treatment and in the IVF treatment? So, how do we
Yeah.
stratify?
Yeah, as I discussed, that stress can definitely affect normal conception. The chances of normal conception can go down because of the high stress level, and there can be increased addictions because of it, again causing a problem during conceiving. Uh, Stress can also lead to certain health-related disorders like diabetes, hypertension, high lipid profile, and so on. And this can in turn cause other severe problems. So definitely, in natural conception, stress is going to be causing a problem. We need to do alteration of our lifestyle, which we are going to see in the treatment section. In the IU and IVF treatment, I need to reiterate here that stress definitely can be a cause for failure of these treatments, and also the failure of these treatments can also cause stress. So the patient should be well versed with what is the success rate, what are the chances of conceiving by each method. So the if the patient has a very high expectations from a IUI cycle, so one single IUI failure can give him or her the stress. So this should not be the case. The couple should be advised properly what is the procedure, what are the chances of success, what is the best we can do, what is the best diet we can take, what is the best nutrition, what is the best exercise which we can do to increase our chances of fertility by IUI or IVF. But what are the what are the most possible success rates associated with these procedures? What are the individualized success rates? This should be understood before the patient goes on to do anything related to this procedures. Because once they have failures, then it is difficult to control the stress levels. So the patient should be made aware of all these possibilities, and then only one should go ahead. So I think stress is a cause of failure of IUI and IVF, and IUI and IVF failure is also cause of stress.
Yes, sir. Inversely, also it is true. Correct. So, what are management? We will come to the management part. How do
Yeah.
we manage the stress? What are the various methods to manage the stress while going to this fertility treatment, while going to IUI or IVF treatment? The couples are facing stress. So, how do we manage as all at our OSS fertility clinic?
Yeah. So basically, stress management is a very huge topic. I won't go into the details of stress management, but to list a few, to enumerate a few, stress management involves changing changes in the lifestyle, and stress management starts with a proper diet. So proper dietary management, the lifestyle modification, which includes proper dietary management, nutrition, health, taking healthy food, avoiding addictions, taking a proper sleep, taking a proper exercise regimen, which will include at least 40 to 45 minutes of daily exercise. All these components will help to reduce stress. Meditation, yes, definitely it has shown its role and effectivity to reduce stress. Yoga has the Indian way of doing exercise has also shown to reduce stress. Along with yoga, we have the pranayam, which can also reduce stress. So all these components can in general reduce stress. Now, how do we reduce stress at Oasis Fertility whenever a patient of IUI and IVF is coming to us? Whenever these patients come to us, we, along with the clinical counseling part, we have the psychological counseling. We have a counselor who takes special care of these patients, who has empathy with the patients. They connect with the patients, and then uh, take the history regarding the stress component also, and they advise them accordingly. We Some couples do have psychological problems, psychosexual problems, like if they have this stress which is very high, they can have depression, psychosexual problems, and so on. So we need a combined team effort along with a psychiatrist in some cases. But definitely along with that, we have the role of counselor is so important. We not only counsel about how to reduce stress, but also counsel regarding the treatment approaches which are available, the methods of treatment which we can do, the treatment successes which can be given, the cost of therapy which is going to be done. All this counseling is done in a so proper way that the patient is doesn't have that much stress. He knows, he or she knows, the couple knows that what treatment they are going to undergo, and what is their treatment schedule, what is the treatment success rate, and what is the treatment cost. If they know all this, I think the stress levels can be kept to a minimum. We also provide them with the options whenever there is a IUI treatment failure or IVF treatment failure. And along with all this, the financial support is so important. And that aspect also we take care at Oasis Fertility, those who have problems managing that. So I think stress at all levels can be kept to minimum if we are giving the patients variety of options, along with a proper counseling, a counselor, dedicated counselor, which is there available at Oasis.
Okay, sir. Fine. So last question from my side, sir. That does the stress, if the stress is properly managed and if the patient's anxiety has been relieved, uh, then does the success improves? Does the success rate of our fertility treatment improves?
Yeah, definitely the success rate will improve once the stress is managed, because the cause of infertility might itself go. Sometimes the couple is a problem family. They are not able to have a proper sexual relationship because of this stress and undue psychiatric problems, and therefore mere talking with them, understanding their problems is very important, and giving them an empathetic approach, telling them the proper way is so important. And therefore this has also increased to the success rate. Once we study the IVF procedures, the failure, the reasons behind failure, stress has been a very important component. So the patient remains to be positive about the treatment, and also definitely they can have some problems during the treatment. They can discuss it out with the clinician or maybe with the counselor and then go ahead.
Okay, sir. Fine. This is all from my side. Any additions you want to do about the topic?
Yeah, thank you, Kanchan. I think there are some questions. Quickly, I just
Okay.
will mention that. So somebody is asking about twin pregnancy in IUI. There is certain risk of twins in IUI, but the risk is less than IVF. That I would like to say. Then there is a question that I'm taking treatment at Oasis, but I'm suffering from stress. You can definitely take help of our counselors. They can allay your anxiety. They can tell you different methods to go about stress management. Next question is, how does stress affect a pregnant woman? I have already told that there is an increased risk of gestational diabetes mellitus or pregnancy-induced hypertension and multiple problems during first trimester, second trimester, and third trimester in a pregnant woman. And therefore, keeping stress to minimum level will definitely be useful. Next question is how much stress can decrease sperm count? That depends upon the level of stress. We cannot specify a different level of different patients have different levels of stress, and therefore this can affect the sperm count that we know, but this will depend vary upon patient to patient. The next question is. The sperm count is 6 million and IUI treatment is being taken. So 6 million is a less sperm count, and you need to take the clinical opinion with your nearest Oasis Fertility Center how to go about the management of this patient, because only count is not important in sperms. We have to analyze the sperm motility and morphology, that is the sperm shape as well, whenever we are advising any treatment. So take a proper consultation with Oasis Fertility Center, any of your nearest centers. Thank you so much for patient hearing. Thank you, Kanchan.